this is a patient we have here who is in his early 30s. He's a very fit individual. He works out quite a bit. But remember what I said about dysautonomia and ADD. Now, here's a guy who's pretty successful in business, and he's a very fit individual because he works out a lot, but he's in complete dysautonomia, which means his autonomic nervous system is whacked, and it is not controlling everything. So this guy comes in for low back pain. We look at this. His brain waves are reversed. So if you look to the far left at theta on the very first graph, that's what beta is supposed to look like. And if you look at beta, that's what theta is supposed to look like. So these brain waves are reversed. That's what ADD is. And as you go into ADD, you'll see that these people have a complete inability to regulate their body in relation. So as we go into heart rate variability, he's a little high on the right-hand side of this screen. And look what happens during one of the stressors. He spikes all the way up here on the left. So what happened was, during this stress, it stressed him so much that his heart went into arrhythmia. So that's pretty drastic. Okay? So we want to note these things and say, okay, well, this is a nervous system situation, because the right side of your brain actually controls your rate at which your heart beats. The left side of your brain actually controls the rhythm at which it beats. So if you go into stress, now you can understand why people have heart troubles. All of a sudden somebody jumps out of the bushes or they have a deadline and fall over with a heart attack because neurologically they're out of sequence. We come over here to heart rate, and you can tell that after the math test he recovered, which is the green one. But other than that, there was minimal recoveries. We come over to his skin conductance. If normal, which is the hand sweating, if normal is between 0.8 and 1.5, this guy's up here hovering right around the 5. So his hands aren't clammy. His hands are pouring sweat. That's sympathetic overload. Why? Because his nervous system is completely out of whack. We come over here to temperature. And his temperature, normal temperature, is between 94 and 97. His temperature is sitting at 80, and it's non-reactive. So his hands don't even warm up when he tries to recover. That's pathological. That's problematic. So if we can pick up on these things early and explain what happens down the road, this guy's on course for some sort of disease down his life if he doesn't take care of this now. All of a sudden, 20 years from now, they say, oh, you have whatever disease, rheumatoid arthritis, you have this disease, you have irritable bowel syndrome, etc. It's because this nervous system has been in disarray for so long that the organs start to fail. If we come down here to breathing patterns, his breathing pattern's well within that normal limit. It's a little chaotic, but it's okay. So his breathing pattern's actually not even that bad. We look at his shoulder activity, though. His left shoulder's well within that normal range, and that's the normal range right in there between 0.5 and 2.5. Look at his right shoulder. If 2.5 is the height side of normal, and he's getting right there smack in the middle at 1.5, look at his right shoulder. His right shoulder's going up to 25. That means this guy's structural imbalance is crazy. So all of a sudden, what happens? Well, he's got a first rib head out. His scalenes on the right are really tight. His trap is really hard on the right. He's got a levator scap contraction. Why? Because this guy's so out of balance. He has to ask his, unbeknownst to him, he's in such compensation, he has to ask his shoulder to assist in the breathing process. So this guy is in complete disarray. Now he understands completely, because when I gave him his report, he said, funny you mentioned my hand temperature, because sometimes my hands get so cold they turn blue. And then, so when people look at this, they start to say, wow, wow, that's really me. Here's an individual who, this is an interesting case, right? So as we go through this case, if you look at the bottom right of the screen where it says SEMG, look at her shoulder activity, both of them, off the chart, right? Her breathing on the left, just left of that, that's a pretty good chart. That's what we want to see right around there. She's on the high side of normal. That's what we want to see. Okay? Her hip temperature's a little chaotic. We're not really getting the warming during the recovery. We're just getting a gradual warming and gradual cooling. So the stresses are affecting her differently and maybe not appropriately. But look at her skin conductance. If you go below 0.5 and don't change, that's a chronic stress issue. So basically, she's been in such overload for such a long time that her hand sweating doesn't even react anymore. So she's got a non-reacting part of her body systematically. We come over here to heart rate, and she's on blood pressure medication, and this is all going to come full circle in a minute, and her heart rate doesn't really recover. She's sitting here at 80, and it pretty much stays at 80 across the board. She doesn't really react to the stresses very much, and she certainly doesn't recover. So we know that you're going to be in cardiac distress, and sure enough, lo and behold, there she is. She's really high on the right side of the screen. So now we know she has cardiac stress. But the funny thing is, her brain patterns are somewhat appropriate, if you know what they look like. So these guys are all spiking during stress, although the sting is way too low. As we come over here, these guys are doing what they're supposed to do, where during recovery they're spiking, although this whole brainwave is only supposed to go as high as 24 to 25, and these guys in beta are supposed to go all the way up to 35. They're not proportioned appropriately. But the reason her brainwave looks so good, and my hands are in quotations, are because she's on 4 different psychotropic drugs, because this is a bipolar individual. So although her brainwaves appear okay and her mood is somewhat somber, her body is in complete disarray. And she has diarrhea, she's got colon problems, she's on blood pressure medication. So now we're letting these people know why they're in the conditions they're in. Their body is in complete chaos. If your brainwaves are doing the wrong thing, it's going to constantly send messages to your body to do the wrong thing. So what do we see? These people start to understand their ailments better. And I've had several people literally sit here, start crying and saying, thank God somebody finally understands me. As we go in through this person's in chaos too. Look at her skin conductance. It's almost off. It's almost done. Look at her hand temperature. It's 80 and below. And every time you start seeing people with 80 and below hand temperatures, you're going to start seeing people who have some issues going on. Look at this person's heart rate variability. They're off the chart. The brainwave patterns are no way right. What alpha wave is what this beta wave is supposed to look like, and this beta wave is doing nothing right. Her heart rate, she has an excessive response to the one stress, but for the most part, she just stays flatlined. Her respiration rate is off the chart. Okay, she's at 15, and look at this. She never really recovers. This is an individual who she's had her thyroid removed. She's had kidney failure, so her mother had to give her kidney. She has HIV, and she's lost 75 pounds in 6 months. She weighs 72 pounds now. And the only reason she came in, because she heard we work with children with ADD. So she came in because her 10-year-old child, who, by the way, gets all A's, and insisted on sitting in on the doctor's report so he could understand what's going on with him. This is a 10-year-old. So this kid is awesome. He doesn't have ADD, yet they gave him a prescription for a woman. Once she heard the report, she said, good God, you need to talk about me. So she scheduled a second consultation just to speak about her and everything that's happening with her. And now we display what's going on with her and why she's had all of these issues her whole life is because her nervous system is in complete disarray. Her body is in chaos. And this just keeps happening, guys, with everybody we see in here. Here's a person who has Parkinson's disease. And we see the brain waves are off the chart wrong. Heart rate variability is too high. We have, look at this heart rate. It's at 100, and at certain times during stress, jumps to 120, recovers, jumps to about 110, drops down to 80, goes back up to over 100, drops back to 80. This is pretty erratic reactions we're having with people. Look at his hand temperature now. He has Parkinson's disease, right? And it's not a coincidence that the guy's hand temperature is 80 or below, hovering in the high 70s. It's almost every time you have somebody in the high 70s with their hand temperature, they have some sort of degenerative disease going on. I see it every day in the office. And I'm not treating them for these diseases, and I've got to emphasize that again and again. I'm treating them for their nervous system chaos. All I want to do is allow their body to go into a healing mode, get them out of this stress response and inappropriate stress response, and allow their body to start to communicate with itself. And the greatest thing, like I said earlier, is now we're measuring it. So when a kid comes in with ADD, you're not going to say, oh, well, let's go take an x-ray. Your parents are going to say, what does that have to do with ADD? Let's get these people monitored and see if they even have any of these conditions. Let's measure their nervous system and see, and let them know why they have it. Because when you lose your cervical curve, et cetera, which when those doctors out there who are doing structural work, they're doing great things if you're getting changes. Just reposition why it's working. It's why it's working is because you are putting the proper nervous system information into that person. And it is, in turn, changing the spine. So people who are doing CBP, you're doing great work. You're doing awesome, awesome work. I can't say that enough. But what do you do with that person who they have a good spinal hygiene, but they still have dysautonomia? And their system, they still have all these diseases. Well, because although they're structurally hasn't caught up with that yet, and they still look like they have good spinal hygiene, the nervous system is still in disarray. So let's treat their nervous system. You can still practice however you want to practice, whether you're doing CBP, whether you're doing network, upper cervical. As long as you're putting the appropriate information into that nervous system, you're doing great things. But let's get a better understanding of who we're actually dealing with, because you may need to just go easier on some people than you do others, and other people you may need to be a little more aggressive with them, because now you understand how their specific nervous system works.